Today we are starting with a new series about rapid revision. In this series we will gonna discuss the chapters from class 11 and the chapters of class 12 in one short videos. It will help you to revise properly and quickly. The first chapter today we will gonna discuss is blood and body fluids, or the body fluids and circulation, from class 11. The unit name is human physiology. So let's see, there are two kinds of circulation that is going in the body of organisms. First one is an open circulation and the next one is closed circulation. What is the difference between two? In the first type, there are no arteries or veins or any kind of blood vessels that is carrying the blood or body fluid. But in the next type, there is an organ that is pumping the blood or the fluid throughout the body, and there are arteries and vessels in the body that is covering the whole body and pumping the blood throughout the body. This is the basic difference between these two. One of each kind are the examples of, in open circulation you can give an example of arthropods or porifera or nidaria. In closed kind of circulation you can give example of mammals, okay, because they have heart. Now we are coming to the patterns of blood flow. One is single kind of pattern, that is single circulation, and one is double circulation. When the blood is entering the heart from only one time, then it will be called a single circulation, like the circulation of fishes. The blood is entering the fish's heart only for one time, and as the blood is deoxygenated, that's why the fish heart is also called the venous heart, because only the CO2 blood is entering the heart of the fishes. It looks like this. There are mainly two chambers. The beneath one is a atrium and the above one is a ventricle. It is collecting the blood from the body via two veins. Those are called sinus venosus. And the blood that is collected via sinus venosus is supplied to the atrium, and from that atrium the blood is entering the ventricle, and from the ventricle the blood will go out via a blood vessel that is called conus arteriosus, and this opens into the gill plate, where the organism will collect O2 and exchange it with the CO2 that is present in the heart. As the blood is entering the heart for only one time, that's why this kind of circulation is also called a single kind of circulation. But when we are seeing the double circulation, there are mainly 3 to 4 chambers that is present in the heart. It can be two atriums. There are two atriums and two ventricles in a body of a human or in mammals. What are the differences? The two atriums are collecting O2 and CO2 blood at the same time. That means O2 blood as well as CO2 blood is entering the right atrium and the left atrium at the same time. That's why our circulation type is double circulation. One of it is called pulmonary circulation, because the blood that is coming from lungs, it is oxygenated blood. That means oxygenated blood is coming from the lungs and deoxygenated blood is going to the lungs. This is one kind of circulation, or this is one half of the circulation, that is called the pulmonary circulation. And one half from the left section that is going to the whole body. That means from the whole body the heart is collecting CO2 blood and it is pumping out O2 blood through the whole body. This is called systemic circulation. So in our body there are two halves of circulation. One is systemic circulation, one is pulmonary circulation. So Next, we will talk about the elements that is present in the heart. Elements that is present in the blood. The first element is, or the foremost or the most important element is plasma, that controls the physical form of the blood, that is liquid. And the plasma is constituting the 60 to 65% of the blood. Then there comes formed elements that is also present in the blood, that is RBC, WBC and platelets. What are the functions of these three? At first, RBC. RBC means red blood corpuscle. In a mature mammal, the RBC do not have nucleus. Why? To obtain or to maximize the capacity or carrying capacity of oxygen, RBCs generally when they are mature, they are devoid of oxygen and they are using that extra space to carry oxygen. In a structure of RBC, hemoglobin is present and a simple hemoglobin has 4 chains with it. 2 chains of alphas and 2 chains of beta. Each of the individual chain will carry 1 oxygen with it. That's how the hemoglobin that is present into the RBC, it will help in carrying oxygen. Next, there is WBC. It is helping like a protective wall in the body. There are generally 2 kinds of WBCs. One is granulocyte and another is agranulocyte. What is the basic difference between these two? A granulocyte means who have granules in their cytoplasm, and an agranulocyte means who do not have any kind of granules in their cytoplasm. The granulocyte group can be divided in 3 subgroups. One is neutrophil, the other is eosinophils, and the next one is basophils. Neutrophil helps in forming dendritic cells or phagocytic cells, which helps in immune system or immunity. They act as phagocytic cell or they gobble up the bacteria or microorganisms or engulf them when they are entering the body. The eosinophils is controlling the common allergenic response, and the basophils secretes heparin, which acts as anticoagulant inside the blood. Next, there are agranulocytes. The first one is monocyte. This turns into macrophage or macrophage. They also act as phagocytic cells into our body. And the rest one is lymphocyte. It forms antibodies, and it is the most important kind of WBC on the perspective of our immunity or immune system. Next, the another thing that is present in the blood is our blood platelets. They help in clotting of the blood. And how the process is done? There are 1 to 13 factors in our blood. Those are helping in clotting of blood. And what is the process of clotting? Let's discuss in very brief. When a tissue is damaged in our body, it will release a certain chemical called tissue thromboplastin. This tissue thromboplastin will activate an enzyme that is present inside our serum, that is called the thrombokinase. This thrombokinase, along with the help of Ca2 plus or calcium ions, will convert prothrombin, that is a clotting factor, into thrombin, which is the activated form of prothrombin. This activated thrombin will go and will activate the fibrinogen, which will form fibrin. This fibrin thread will go through polymerization reaction with the help of calciums and will make a fibrin polymer. Now, these fibrin polymers will make a meshwork at the place where the damaged tissue is found, or it will form a clot. at that place to protect or to prevent the leakage of the blood. This is the very brief account of blood clotting. Now let's discuss about blood groups. There are three kinds of antigen that can be found in our blood. One is antigen A, one is antigen B, and one is Rh antigen. At first, let's discuss about antigen A and antigen B. A person having A blood group can have their genetic makeup like IA and IA or IA and I0. 0 means null, or it can be also called O. As A is a dominant character, that's why the blood group of this man or woman or this person will be A. Just like that, in a person who has blood group B, the genetic makeup will be IB or IB-I0. Just like that, in a person with blood group O, the both sets of genes will have O or null sets. And in case of AB, they have one A and one B antigen in each genes. Okay. Devoid or left of these two, there is another antigen that is present in the body, that is Rh antigen. What is the function of Rh antigen? Rh antigen is found in 75% of the human population. A person with Rh antigen is called their blood a positive blood group, and a person without Rh antigen can be called a negative blood group. That means if I am having antigen A, antigen B and Rh antigen, my blood group will be AB positive. If I am having only A and Rh antigen, then it will be A positive. If I am having nothing but only having Rh, at that case my blood group will be O positive. Just like that, the blood grouping is done via this ABO method with the help of Rh antigen. There is a special case called erythroblastosis fetalis. Suppose a married couple, A and B. Okay, they two have different blood groups. The mother do not have Rh antigen, that means she is negative, and the father has Rh antigen, that means he is positive. As I said before, Rh is a dominant character. So one of the parent, if having a Rh group, the next generation will must have Rh group. So when they are having a baby, the baby must have a Rh group because one of the parents are having Rh group, and in this case the father is having Rh group. When the baby is in the womb, there is no kind of problem. When the baby is in the womb, the child has positive blood group and the mother has negative blood group. At the time of parturition or the delivery, if some amount of blood is mixed with the mother's blood, if some amount of blood of the offspring or the baby is mixed with the woman's blood, then this kind of blood which do not have Rh antigen like the mother's blood, it will find a new kind of antigen in its blood, that is Rh antigen. So the Rh antigen that is present in the blood of the baby will enter the mother's body, and now the mother's body will determine this Rh group as a foreign substance, and as this is a foreign substance, the mother body will make an antibody against this Rh antigen. So like this, the Rh antigen is entering from the baby to the mother. Now the mother is making an antibody. Now the mother body is making an antibody. So till now no problem. If this couple goes for the second child, the second child also will have positive blood group because father is positive, and now the mother has positive antibodies, or the mother has antibodies against the Rh antigen that was present on the first baby, as their father has Rh antigen. So the next baby will also have Rh antigen, but at that time these antibodies, those are made in the mother's body, will cross the placenta and introduced or entered into the baby's body, and these antibodies will destroy or clot the blood of the body in the baby. As the blood clotting takes place, the baby will die in the fetal condition. This condition is called erythroblastosis fetalis, as the two parents have different kinds of blood groups, and especially the mother has the negative. That's why the mother do not have exposure of positive blood group. When the mother is getting exposed to the positive blood group for the first time, her body is making the antibodies against that positive blood group. When the next baby is coming with the same blood group, these antibodies against this positive antigen will enter via crossing placenta into the next baby, and it will clot the blood and kill the baby. This abnormal or this process is called erythroblastosis fetalis. So how to encounter that? Just after the first delivery, the mother has to be injected with anti-Rh antibody injection. Anti-Rh antibody injection will enter a certain kind of material into the woman's body, and it will destroy any kind of anti-Rh antibodies if that is present or if that is made into the mother's body. So when the next child comes, there will no antibodies in the mother's blood. That's why the baby will be safe. Okay. Now we will discuss about the process of blood circulation in human heart. So let's see a diagram of human heart. So this is a diagram of human heart where 4 chambers of the heart are represented. This side is called the right side of the heart, which is dealing with CO2 blood, and this side is called the left side of the heart, which is dealing with O2 blood. Let's say the sections. The top ones are called atriums and the bottom ones are called ventricles. At first, the 2 atriums will receive the blood via certain arteries and veins. So let us know a very minimal terminology before covering this topic. First, atrium and ventricle. As let us know you some tricks to remember this process. In alphabet, A comes before B. So always the blood will come to the arteries before the to the atriums before the ventricle. You can remember this like this. As A is prior to V in alphabetical scheme, so the blood will always come to the atriums before the ventricles. Okay? The right side deals with CO2 blood, the left side deals with O2 blood. Another thing, arteries and veins. Anything that will enter the heart will be called a vein. So entering heart will be a vein, and exiting heart will be an artery. So it will help you reminding things, or you will not get confused. So the first thing is the atriums will be filled with blood first, then the blood will come to the ventricles as an alphabetical order. Any blood vessel that is entering the heart will be called a vein, and any blood vessel that is exiting the heart will be called a artery. Next thing, systole and diastole. There are two phases of the heart, those are systole and diastole. What is the basic difference between these two? See, the word systole is smaller than the word diastole. So you can remind it like that. As systole is the word, smaller word, so in systole the heart will go smaller, and as the diastole is a larger word, in diastole the heart will go larger. So in systole the heart will be small, that means the heart will pump out the blood, and in diastole the heart will go larger, that means it will pump in the blood. So this is the basic difference between these two. Systole means pumping out of the blood and diastole means pumping in of the blood. Okay? So at first what happens, let's see. This thing is called superior vena cava. Superior vena cava. As this is a vein, that's why, as this is entering the heart, that's why this is called a vein. So the upper section is called superior and the lower section is called inferior vena cava. At first, the right atrium is collecting CO2 blood via superior and inferior vena cava, and as it is collecting the blood, it will go larger. That means it is in diastolic phase. Same as the left atrium will collect O2 blood, and this O2 blood will come from the lungs that is present prior to heart. So the lung will supply O2 blood via pulmonary vein. As it is entering the heart, that's why this is called pulmonary vein. So the right section of the heart, that is right atrium, is collecting CO2 blood via superior and inferior vena cava, and the left section of the heart, that is left atrium, is collecting O2 blood via pulmonary vein. The both atriums, as they are collecting the blood, that's why they are in diastolic condition. When these two atriums are filled with blood, the blood will come downwards into the ventricles. The right ventricle will receive CO2 and the left ventricle will receive O2 blood. There are valves present in this path. They are called AV valves or auriculoventricular valves. The right one is called tricuspid valve and the left one is called bicuspid valve. So when the blood is coming to the ventricles from the atrium, these AV valves will open and the blood will enter into the ventricle. As the ventricles are receiving the blood, that means they are in diastolic condition. When the ventricles are filled up with the blood, these AV valves will gonna close. Now the blood from ventricles will enter the next set of blood vessels. The blood from right ventricle will go to lung for purification. It will enter into the pulmonary artery. It will enter into the pulmonary artery for purification and it will go to lung. And the blood from left atrium, that is oxygenated blood, it will enter into the aorta. This is called aorta. It will enter the aorta and this aorta will distribute the blood throughout the body. So what did I say? The first section, that is called the pulmonary artery, it will send or it will distribute deoxygenated blood to the lungs, and the aorta, which is receiving the oxygenated blood from the left ventricle, it will distribute this blood throughout the whole body. So this is the basic system of atrium and ventricles. This will result in the circulation of the body or circulation throughout the body using the main circulatory organ, that is human heart. There are few basic things that we gonna discuss. That means this thing, there is a septum between these two ventricles. This is called interventricular septum. Interventricular septum. When a baby is in embryo condition, there is a pore or there is a hole in this wall. There is a minute hole. There is a minute hole in this wall. This hole in the embryonic phase is called foramen ovale. Foramen ovale. At the time of delivery, this hole will be closed. At the time of delivery, this hole will be closed, but there will be a very little depression in the wall. This depression is called fossa ovalis. At the embryonic condition, there is a very minute hole is called foramen ovale. At the time of delivery, this hole will gonna close and it will result in a depression called fossa ovalis. So this is the basic structure of human heart, where we can say there is 4 chambers, 2 atriums at the top and 2 ventricles at the bottom. The 2 atriums is collecting O2 and CO2 blood. The O2 blood is collected by left atrium and the CO2 blood is collected by right atrium, and they both are in diastolic condition. The blood is coming to the ventricles, then the blood is entering the aorta and pulmonary artery. There are also valves present in the aorta and pulmonary artery. These valves are called pulmonary valves and aortic valves. That is, the valve in the aorta is called aortic valve, and the blood or the valve is present on the pulmonary artery will be called pulmonary valve. Okay. So this is the process of circulation throughout the heart. You can see in the diagram, the left section of the heart is more muscular than the right section. As the left section of the heart, that means mainly the left ventricle, will pump the blood throughout the body, and as this is a tough job to do, to pump the blood throughout the body, that's why the left section of the heart, that means the left ventricle, is more muscular than the right one. Now we will discuss the cardiac cycle. There are 3 phases in the cardiac cycle. We just discussed it. At first, the atriums will collect the blood and they will perform systole. The first phase in the cardiac cycle is atrial systole. In this atrial systole, the blood from atriums will enter into the ventricles. Then, when the atrial systole is done, the atrioventricular valves, that is the tricuspid and the bicuspid, will gonna close, and it will produce a sound just at the time before ventricular systole, and this sound will be lub, L-U-B. This is the first heart sound that is produced just after the atrial systole is done. That means the loading of ventricles is just done. That means the blood from atrium is just entered into the ventricles. After that, the blood that just entered into the ventricles will go to the whole body and will go to the lungs. Now the ventricle systole will be done. What is happening in the ventricular systole? The blood from 2 ventricles will release from the heart. The blood that is present in the left ventricle will go to the whole body, and in the right ventricle it will go to the lung. Now this process will lead to the opening of pulmonary valves. Pulmonary valves mean at this time the valves, that is pulmonary and aortic valve, will open. The blood from the ventricles will now go to lung in one set and throughout the body in another set. This will result in ventricular systole. So at first atrial systole, after atrial systole the AV valves will gonna close and the blood from ventricles will go throughout the body and will result in ventricular systole. Just after the ventricular systole is done, the semilunar valve, that means the pulmonary valve and the aortic valve will gonna close just here, and it will produce the second sound of the heart, that is called dub. After that, see, the atrium is already in diastole. The atrium at first performs systole, then the AV valves close. From that time, the atriums are in diastolic phase. And whenever the ventricle completes its systole, it will also go to diastolic phase. Now, this phase, just after the ventricular systole, the both atriums and ventricles are in diastolic phase. And that's why this phase is also called the joint diastolic phase. So at first, atrial systole, then ventricular systole, then joint diastole. These are the three phases of cardiac cycle. Now the conduction of heart. How the beat, that is this love dub, how this beat is conducting throughout the heart. If we see a simple diagram, there is a simple node here that is called cyanoatrial node or SA node, that is producing the beating of heart. This beating is helps in pumping the both atriums. This node is called SA node, and from this SA node the beats will go to here. This is called AV node or auriculoventricular node. The first node is known as cyanoatrial node. This is known as the general pacemaker or the natural pacemaker of the heart. Now from this natural pacemaker, the both atriums will gonna take the signal, and from there the signal will pass to the AV or auriculoventricular node. This AV node will pass the signal for pumping, that means depolarization signal. It will pass via a bundle of nerves. This is called the bundle of His, and this bundle of His will divided in smaller fragments, and it will cover the whole wall of ventricles via Purkinje fibers. So the first beat is made by SA node, that is the natural pacemaker. It is then transported to AV node, that is the auriculoventricular node. It is then signaled or transported by a bundle of His, and from there it is divided in certain fragments known as Purkinje fibers. So this is the basic format of conduction of heart. After that, we will gonna discuss about the second liquid that is also present in our body, that is lymph. Just devoid of the RBC, the rest of the blood can be called a lymph. Lymph is a complementary liquid that is present in our body, and it works for lymphocytic stock in our body. It is generally a lymphocytic solid stock in our body. It helps in formation of lymphocyte cells, and these lymphocyte cells will play a huge role in our immune response. That's why lymph always plays an important role in our body. It is a complementary liquid, as the blood quantity in our body, if decreases, some of the lymph will be converted into blood, and if the blood quantity is increases, then some of the blood will converted into the lymph. After that, there are certain diseases in this chapter. Those are CAD or CAD or coronary artery disease. Coronary term means anything that is related to heart. If any kind of coronary artery, that means an artery that is supplying the blood to the cardiac muscles, if it is blocked by somehow, then it will result in the blockage of heart or heart attack or heart failure. This will be called coronary artery disease. Another thing that is also present here is hypertension. It is also a condition where the thyroxine secretion in the body is high, and it is result in contraction of the atrium wall, and this will result in high levels of blood pressure. Any kind of situation will encounter this process in a patient like this, and it may result in a cerebral or any kind of general stroke. That means the leakage or bursting out of arteries in the body of the patient. So this is the whole chapter that we just discussed in one video, that is the body fluids and circulation. Thank you.